Good afternoon and aloha to all of you. I want to thank all of you for coming here. Today, we take another step towards securing timely, predictable funding for the veterans' health care system. Our plan will create a transparent funding process that will yield sufficient, on-time funding, enabling VA to care for veterans more effectively. Historically, VA's healthcare system has been plagued by underfunding. Only a few years ago, VA reported a shortfall of over $1 billion. VA has come back to Congress repeatedly to get additional funding for healthcare costs. Fortunately, in the past 2 years, we have begun to change course by providing record funding to meet the increased needs of veterans and their families. Even with sufficient funding, the money for VA has been provided late. In 19 of the past 22 fiscal years, it was provided late. This means that the largest healthcare system in the country, to which millions of wounded and indigent veterans turn to for care, does not know what funds it will receive, when it will be funded, or in reality, whether vital programs will receive funding at all. This is no way to finance a national care system with such a sacred obligation. Today, we suggest a better option. I am proud to introduce the Senate version of the Veterans Health Care Budget Reform and Transparency Act. This bill would require that veterans' health care be funded 1 year in advance of the regular appropriations process. By knowing what funding they will receive 1 year in advance, VA would be able to plan more efficiently and better use taxpayer dollars to care for veterans. I am proud to join a number of our nation's leading veterans organizations and a bipartisan team of supporters from the House and the Senate in calling for this bill's passage.
Mr. Chairman, it's really an honor to work jointly with you and with all of you in this room for this bill. I have introduced with many of my colleagues the House version of the same bill. Chairman Akaka has laid out the reasons for this bill. You know, there's only one thing I think more important than having enough resources in the VA, and that's to make sure those resources are delivered in a timely, predictable fashion. If you don't have that, you can't hire, you can't fill vacancies, you can't purchase equipment. You essentially ration health care. And there are people here I've talked to that could not get appointments because the person was only there 2 days a week instead of 5 days a week because they didn't have the funding. Or that this specialty could not be hired yet because their funding had not come through. We cannot ration health care to our nation's veterans. That's a crime.
If you think about it, for those individuals who are incarcerated for whatever reason, they are assured their health care. We can do no less for the veterans of this great nation of ours.
I spent some time in the 90s on a school board, president of a school board for a while, and had on a smaller scale the same experience where you never knew if the state budget was going to pass or when, or whether our school district budget would be rejected by the voters, and how do you hire, how do you plan, how do you predict class sizes, et cetera. Imagine the same problem, but when the lives, literally the lives and health and mental health of our veterans are depending on it, and magnified several orders of magnitude.
As a former mayor, I have to tell you, this is something we did, 2-year budgeting, because it creates some predictability, stability, but also gives a better opportunity for you to look at how to improve the service levels. And that's what this will do, as instead of us shuffling paper all the time and worrying about each budget and then the poor agency suffering each year trying to figure out what's next and when that money will come, they will have some future predictability, but we can sit and look at how to improve the system more and more. So when this piece of legislation was offered up by the chairman as an opportunity to sponsor, there was not even a hesitation from me as someone who's experienced two-year budgeting.
It was about 2 weeks ago, I think, Chairman Akaka, we had a hearing in this very room, talked to members of the VSO about what their top priority was. And it was about advanced appropriations. And so who really makes this happen are you guys. You people who are fighting for your veterans every day. You people who step up the plate and talk about real-life situations and how our veterans are being impacted across this country in a negative way without advanced appropriations. So I want to thank you. I look forward to helping Chairman Akaka push this bill through as quickly as possible, and we'll see you in the White House when the President signs it.
I'm appearing today on behalf of 9 organizations, Partnership for VA Healthcare Budget Reform. Those organizations include AMVETS, Blinded Veterans of America, the Disabled American Veterans, Paralyzed Veterans of America, Jewish War Veterans, Military Order of the Purple Heart, the American Legion, the Veterans of Foreign Wars, and the Vietnam Veterans of America. Our organizations came together a decade ago to form this partnership to try to reform VA healthcare funding. I don't know how anyone can oppose legislation that would provide transparency to the budget process and provide a sufficient, timely, and predictable budget to VA so that veterans can get in and receive quality health care in a timely manner.
I am the executive director of IAVA, but today we stand here to represent veterans of all generations. We're here on behalf of the Military Coalition, an alliance of 35 different organizations representing 5.5 million service members, veterans, and their families. So you've heard a lot of statistics. I want to tell you a story. I want to tell you about one of the young vets who's here with me today representing IAVA. His name is Ray Leal. Ray served as a Marine in Fallujah during some of the heaviest fighting, earning a Bronze Star with Valor as a private first class, which doesn't happen very often. He came home to South Texas right next to the Mexico border. His closest VA hospital is in San Antonio, 5 hours north. In his nearest outpatient clinic, there's just one psychologist taking appointments 2 days a week. It's not because there's a lack of need. The appointments fill up 2 days after the calendar opens. The psychologist only works 2 days because this South Texas clinic, like many other clinics and hospitals, have to stretch their funding to make sure it lasts the whole year. They don't know how much money they'll have next year, so they have to ration care. The VA employees want nothing more than to help these veterans, but their hands are tied. Ray's a boxer when he's not a Marine, and he's a fighter, but he shouldn't have to fight to get care at a veterans hospital. For the millions of veterans like Ray, we must fix the broken VA healthcare system.
Each year, from July forward, we can't hire anyone. Can't hire anyone. We don't know what the budget's going to be. And then by February, we would get a budget, and we got to hire right fast, but nurses aren't graduating from school in February. They're coming out in the springtime and in the summer. All of those type of things. The physicians are coming out. All of the therapists. We weren't able to hire the staff and to get that staff on board to be there to care for those men and women that have served this country so faithfully.
We didn't know if we were going to be able to keep doing the psychological ward, the psychiatrists, or the other specialty thing. We didn't know if we were going to be able to open any other clinics in these rural areas so that people don't have to drive so far. So it is a very critical issue. It's our #1 issue, just like it is for the fellow veterans service organizations here. And I'll say this, I've never seen the veteran service organizations together like they are right now.
Thank you all very much for your statements, but it's clear. And it's one message, and they're united. And so here we go, and this is a step that we're taking, and we're going to move it as quickly as we can. And we're looking for a way of doing this. And the big question is, if we can't do it this way, show us another way that we can do it. But we must do it to help our veterans of our country.